Dr. Susan here. I'd like to tell you about the 3 most important things when you're picking a labiaplasty surgeon. First is experience. I would look for a surgeon who's done at least 100 procedures. The reason why is that we keep learning as surgeons for at least that long, and you don't want to be a patient that your surgeon's learning on. I've done over 500 labiaplasty procedures in the last 10 years, so I can truly tell you that I fit into that group. And there are lots of other good surgeons out there too, but make sure you ask them how many cases they've done. Second, you want to see before and after pictures that actually come from that surgeon. Believe it or not, some doctors use pictures that come from other surgeons, but you want to see a whole range of pictures that that surgeon has done themselves, and try to find some pictures that look a little bit like your anatomy so you can see what your results might actually be like. Now, we know that there's a wide range of normal. Some labia are larger than others, just like breasts and noses and other body parts. But it's really important to look at those pictures so you can first of all understand what's normal. You might even choose not to have the surgery after that, and that's a good option for many people. But if you do choose to proceed, you can get a good idea of what your results will be like. Third, you want to have a doctor who's going to spend a lot of time with you. This is a big decision. Surgery is not a small choice to make. It's expensive. There's going to be some time out of work, so you want to make sure that the doctor dedicates the appropriate amount of time to you. At my office, our first visit usually lasts about an hour. We do an exam, we take some pictures that we look at together, and I actually walk you through the whole procedure, making drawings of what the surgery is going to look like to make sure that we're on exactly the same page as to what you want so that I can achieve that goal for you. If you have a doctor who just takes a look at you and then wants to book you for surgery without going through that process, I'd be a little bit wary. Just ask some more questions because you want to make sure that you know exactly what to expect and all your questions have been answered. It's also really important that you have a preoperative visit. This is a real surgery. You need to go through a consent form line by line in detail, be given very clear postoperative instructions, and someone that you can talk to should you have a problem or if you have a question. So in our office, our pre-op visit again takes about an hour, sometimes less, depending on the questions. We can do it in person, or if you live out of town, we can do it by Zoom or Skype. But it's really important to sit down and go over all of those questions so that, again, you know exactly what to expect. And those are my 3 most important things when picking a labiaplasty surgeon. Thank you.